I'm Alisa Brownlee, an Assistive Technology Specialist with the ALS Association National Office and Greater Philadelphia Chapter. Welcome to another Assistive Device Demo, or ADD, video. And I am delighted to be here with my friend and my colleague, Kirk Behnke. And Kirk is a consultant for Behnke Romack. And Behnke is a company that makes speech-generating devices that can help someone with ALS. So Kirk is here to show you briefly about how this device can help someone with ALS communicate and access the internet. So.
Great, thanks Lisa. I'm going to show you the Accent product, which is, Accent comes in an 8-inch, a 10-inch, and a 14-inch screen. And so this is the 14-inch screen, so if you want to come a little bit closer, I'll do some demonstration of what we have available on the Accent device. Now this is what we're using right now. It's called the Essence, which is a literacy-based communication device. So that if someone who has literacy can access the quick communication and keyboard rather quickly. So one of the demonstrations on communication, we have a keyboard, and so we can start typing, like I can say hello,
E,
and it'll come up here or here with
L,
hello.
hello,
And so it comes real quick with any type of word abbreviation expansion, also word prediction. We also have, if you go into quick messages, you have quick messages here, so that you can say, I'm wonderful, really quickly. Or if you needed to have some help,
I need help,
you can have some help there rather quickly. So again, real quick messaging, quick communication, and this is all about with access with a finger. Now if you don't have any access with any types of digits, we can also go into eye gaze. And I'm going to turn eye gaze on real quick, and I'm just going to look at this screen and it'll show you exactly how I can access. So if I go into my keyboard, I can just look at W, want. So I want to come. So that's all through just the use of my eyes. There's also some other ways that we can access, and this is another way which we call head pointing. And so we have what's called the new point, where you would use your head to actually access the device as well. So when I turn that on, I have to wear these lovely glasses because it has a little dot on it, so I don't have to reuse my dot all the time. But basically I have the same thing, that I can just turn my head and I can gain access to all different types of communication.
A.
So I can say thank you,
Y, O, U, I'm wonderful, want to come, thank you.
So can you point out that this is, show them what each is?
Sure, this is the new point. This is the camera that reflects off of the dot. And then this is the eye gaze system. And all of these are sold separately, excuse me, separately, in addition to the communication device itself.
So somebody can get this and add on later?
Yes, absolutely. So if you have the capability of touch, that's great. And then you can also add on, whether it be the eye gaze or the head tracking system, or even switches. We can also add switches to this as well.
So it's a device that can transition as the disease progresses.
Correct, absolutely.
And that's what we really want.
Yeah, sure.
For people with ALS.
Exactly. And then you also have, conversation starters.
I forgot to mention
that you can have just really quick communication, very transparent.
And can you tell our audience here, can this be mounted onto a wheelchair, or how do I transport this?
Exactly. You can get it mounted just the way it is, battery operated tablet, or you can have a mount that goes onto a wheelchair. You can have a table mount. You can have a floor mount. You can have as many mounts as you want. It all depends upon the needs of the individual, of course.
Again, it can transition as the disease progresses.
Absolutely.
And so can you tell our folks here, how does one contact Behnke to get this information?
All you have to do is go to our website at prentrom, prentrom.com, and you can look up your consultant. We have the National Consultant Directory that's there. I happen to be the one in Philadelphia. So if you're in Philly, look me up. But we do have, I believe, about 35 other consultants nationwide.
And lastly, I think people will say, is this covered under insurance?
Absolutely.
Okay.
And we do all the paperwork for you.
And that's the important part too, is that Behnke will walk you through how to get the appropriate paperwork, how to find a professional to work with you on this.
Exactly, because you really do want an evaluation. We can give you a free trial if you're looking for one for up to 30 days, and then we can help you with the submission of the paperwork, the insurance companies, the whole piece, and then we submit on your behalf.
Okay. So it's important to know that communication is possible throughout the trajectory of this disease, and there are companies like Cranky Rummuck and others that can assist you. So I want to thank you for tuning into our video. Thank you, Kirk.
Thank you.
Really appreciate it, and we will continue this series